This video is brought to you by Global Men's Wellness, your 24/7 AI health expert. No copays, waiting rooms, or awkward conversations. Just real answers whenever you need them. Visit globalmenswellness.com to try it free and get your own on-demand concierge-level wellness expert today.
All right, welcome back, everyone, to the 21st Century Men podcast. Today, we're going to be diving deep into chapter 92.
Oh, this is a good one.
Yeah, this is going to be an interesting one. We're diving deep into chapter 92, circumcision.
Yeah.
And as always, our goal here is to kind of summarize the chapter.
Give you the highlights, right?
Yeah, give you the highlights and the key facts and takeaways, and try and make it as clear and understandable and digestible as possible.
Yeah.
So let's jump right in.
Let's do it.
I guess we can just start from the top.
Yeah, top of the chapter, right?
Yeah. So it starts off with a pretty funny quote from Jim Gaffigan.
Yeah, he's a funny guy. Always good for a chuckle.
Yeah. He's talking about the history of circumcision, right, and how Abraham circumcised himself.
Oh, right. Yeah.
And he's joking about that. He says, wow, I can't even get to the bank before it closes. That's kind of sets the stage for...
Yeah, puts it in perspective.
Yeah, it's like, wow, this has been around.
It's an old procedure.
Yeah.
Very old.
For a really long time.
Thousands of years.
Yeah. And the book defines circumcision as the surgical removal of the foreskin of the penis.
Pretty straightforward.
Yeah, pretty straightforward.
Yep. And
it's recognized as, the oldest surgical procedure in the world.
That's pretty impressive.
Yeah.
Still going strong.
Yeah, it's amazing.
Yeah.
And it's not just a historical thing.
No, not at all.
It's still very prevalent today, and the book goes into some of the statistics.
Yeah, the numbers are pretty interesting.
Yeah, it's something like 1/3 of men
worldwide. Yeah.
Worldwide,
which is a lot.
It's a significant portion of the population.
Yeah. But it's interesting because the distribution is not even...
Oh yeah, it varies wildly from country to country.
You've got places like England, for example,
right,
where it's pretty low, around 6%.
Yeah.
Whereas here in the U.S., it's much higher.
Yeah.
Something like 70%.
Yeah, 70%.
Big difference.
Yeah, there's a huge difference.
Huge difference.
And then when you look at parts of Africa.
Yeah, it can get even higher there.
Yeah, it can exceed 80%.
Over 80% in some places.
Yeah.
Really interesting to see that kind of variation.
Yeah, definitely.
Definitely.
And the book talks about, one of the reasons for those higher rates in Africa is...
Oh, yeah, it's a major factor.
Yeah.
Public health.
Yeah, and specifically
HIV.
HIV transmission.
Yeah, studies have shown that there's a lower rate of transmission in circumcised men.
Oh, wow.
So that's led to a big push for circumcision in those regions, as a public health measure.
Yeah. So it's interesting how something like this with such ancient roots can have these modern day implications.
Absolutely.
Yeah. It's fascinating.
Yeah. And the chapter also mentions, the religious aspect.
Oh, right, of course.
The circumcision.
Yeah, can't forget about that.
Yeah, and how it's mandated in both Judaism and Islam.
It's a fundamental practice.
Yeah.
Deeply ingrained in those faiths.
Yeah, for sure.
Yeah.
So now that we've kind of talked about the prevalence and some of the reasons behind it.
Yeah, why it's so common.
Yeah.
Globally and historically.
Yeah, let's dive into the benefits that are associated with circumcision.
Okay, let's take a look at the pros.
Yeah.
What does the book say about that?
So the book references the American Academy of Pediatrics, the AAP.
Okay.
And their position seems to be pretty supportive.
Yeah, they actually say that the benefits outweigh the risks.
Yeah, the preventive medical and public health benefits outweigh the risks of newborn circumcision.
Interesting.
Yeah.
So what are some of the specific benefits that they highlight? Well, both for newborns and later in life, the book mentions the release of a trapped penis.
Oh.
Which is called phimosis.
Phimosis, yeah.
Yeah. Or foreskin that gets stuck behind the head of the penis.
That's called paraphimosis.
Paraphimosis.
Those both sound pretty unpleasant.
Yeah, they don't sound good.
No, not at all.
So phimosis, basically it's when the foreskin is too tight to retract.
Over the gland.
Over the glands, yeah, the head of the penis.
Right.
And paraphimosis is when it gets pulled back and can't return to its normal position.
Oh, wow, so it gets stuck.
Yeah.
That's got to be painful.
Yeah.
And probably could cut off circulation too, right?
Yeah, yeah.
So circumcision can really help with those problems.
Yeah, it's a solution for those.
Yeah.
The book also mentions that removing the foreskin can lead to less inflammation.
Okay, so less irritation, basically.
Yeah, reduced inflammation of the glands.
Makes sense.
Yeah.
Less skin, less surface area.
Yeah.
Fewer places for bacteria to hide.
Yeah, less moist environment.
Yeah, exactly.
Where bacteria can grow.
Right, right.
Yeah.
So it's like a hygiene thing too.
Yeah, yeah. And then one of the benefits that I thought was particularly interesting was the connection to sexually transmitted infections.
Oh, yeah, that's a big one.
Yeah.
What does the book say about that?
So the book mentions that there's a lower chance of getting genital warts.
Okay.
Or condyloma, which are caused by HPV.
Genital warts, those are no fun.
Yeah.
So circumcision can reduce the risk of that.
Yeah.
Yeah, it's good to know.
And we already talked about it a little bit, but the reduced risk of HIV transmission.
Right. That's a major public health benefit.
Yeah, yeah.
Especially in areas with high HIV rates.
Yeah.
It's been shown to significantly reduce the risk of transmission.
Yeah,
So
yeah.
that's a big deal.
And it's not just HIV. The book mentions lower rates of other STIs as well.
Oh, really? So it's kind of like a general protection against STIs.
Yeah, yeah.
Interesting.
And for, parents of young boys, the chapter mentions a lower incidence of urinary tract infections.
Oh, UTIs?
Yeah, UTIs, which I imagine would be,
Yeah, it can be really painful.
Yeah.
Especially for little kids.
Yeah.
So circumcision can help with that too.
Yeah. It reduces the risk.
Okay.
Yeah. And then maybe one of the most significant benefits
What's that?
that was mentioned is the reduced risk of penile cancer.
Oh, wow.
Yeah.
That's serious.
Yeah.
So it can actually prevent cancer.
Yeah. Yeah.
That's a pretty compelling reason.
Yeah. And while penile cancer is rare overall,
Right.
the data shows that it's much lower
Okay.
in circumcised men.
So that's good.
Yeah.
Yeah.
So with all these, potential advantages.
Yeah, there's a lot to consider there.
Yeah, for sure.
What does the book say about the main goal of the procedure itself?
So the chapter says that the primary goal is to achieve a good cosmetic result
Okay.
with adequate removal
Right.
of the foreskin.
So it's not just about the medical benefits, it's
No.
also about how it looks.
Yeah, yeah. Interesting. And it should ensure that the glands is sufficiently exposed
Right.
to prevent.
Oh, you don't run into those issues.
Oh, yeah, phimosis or paraphimosis.
Gotcha.
Right, right.
Makes sense.
So we've looked at the potential benefits.
Yeah, we've covered the pros.
Yeah, but like any surgical procedure,
Right. There's always potential downsides,
yeah, there are potential complications,
complications.
and the book talks about those as well.
Okay, so let's talk about the cons.
Yeah.
What are some of the things that can go wrong?
So the book does mention the possibility of a loss of sensitivity.
Oh, really?
Yeah.
That's something you hear about sometimes.
Yeah.
Is that a common thing?
Well, the book actually points out that it's a debated topic and it's difficult to measure objectively.
So it's not really clear cut.
Right.
Some people might experience it, some might not.
Yeah. Yeah. And, while some individuals might perceive a change, it's not a consistently documented
Right.
or easily quantifiable outcome.
So it's hard to say for sure.
Yeah.
Yeah.
What other complications
Okay.
does the book mention?
Yeah, what else can happen?
So, fortunately, most other complications are rare.
Okay, that's good.
Yeah.
At least not common.
Yeah. Yeah.
But what are some of the rare ones?
They include things like bleeding.
Okay, that makes sense. It's a surgical procedure.
Yeah.
There's going to be some bleeding.
The penis becoming concealed by scar tissue.
Oh, wow.
Yeah.
That doesn't sound good.
The formation of skin bridges.
Skin bridges?
Yeah, where the foreskin reattaches.
Oh, so it grows back together
Yeah.
in the wrong way.
To the glands.
Okay.
Infection.
Infection, yeah, that's always a risk with any surgery.
Yeah. Difficulty urinating, which is called urinary retention.
Urinary retention.
Yeah.
That sounds uncomfortable.
Yeah, and very rarely damage to the urethral meatus.
Urethral meatus.
Yeah.
What is that exactly?
So the chapter explains that the urethral meatus is the opening at the tip of the penis
Okay.
where urine and semen exit the body.
Right, right.
Yeah.
So it's a pretty important part.
Yeah.
Yeah.
So, damage to this area is uncommon.
Good.
Yeah.
good that it's uncommon.
But it's a serious potential complication.
Right, so it's something to be aware of.
Yeah.
Yeah.
So, while these risks exist,
Yeah.
the chapter does emphasize their rarity.
Okay, so it's not something to be overly concerned about.
Right.
But it's good to know the possibilities.
Yeah, exactly.
All right, so we've talked about the benefits. We've talked about the risks.
Yeah.
Let's move on to how it's actually done.
Yeah, so the book outlines several different techniques.
Okay, so there's more than one way to do it.
Yeah.
Interesting.
Yeah, so it describes various methods for removing the foreskin, including the dorsal slit,
Dorsal slit.
different approaches using shields and clamps,
Oh, yeah.
and surgical excision with sutures.
All right, so a few different options.
Yeah. And it also covers the different types of anesthesia.
Oh, right, because you're going to need some pain relief
Yeah.
for that.
That can be used,
Okay.
ranging from local numbing agents,
Okay.
like penile ring blocks and dorsal nerve blocks,
So they just numb the area.
to lidocaine sprays,
Lidocaine. Yeah.
and in some cases even general or spinal anesthesia.
Wow, so it can be a pretty involved procedure,
Yeah.
depending on the technique.
Yeah, for sure.
So let's break down some of these techniques a little bit.
Okay.
Starting with the dorsal slit. What is that exactly?
So the dorsal slit is basically a surgical cut
Okay.
that's made along the top of the foreskin
Okay.
to widen the opening.
All right, so they make an incision.
Yeah.
Got it.
And it's often used to relieve phimosis.
Okay, so that's when the foreskin's too tight.
Yeah, yeah.
Right.
And particularly in situations where the priority is to allow for urination.
I see. So it's like an emergency procedure.
Yeah, sometimes in older men.
Okay.
But the book does mention that it's not considered the most cosmetically desirable outcome.
Oh, so it might not look the best.
Yeah.
Got it.
Then there's excision with suturing.
Okay, so this is where they cut away the foreskin.
Yeah, it's a more traditional surgical approach.
Right.
The surgeon removes the excess foreskin.
Okay.
And then closes the edges of the skin.
Right.
With sutures.
Stitches, basically.
Yeah, yeah.
Okay.
And this typically takes a few weeks to heal.
A few weeks, all right.
Yeah.
So it's a bit more involved.
Yeah.
Yeah.
Then you have the shields and clamps methods.
Okay, the shields and clamps.
Yeah, which sound interesting.
Yeah, how do those work?
So the book highlights the Mogen clamp and the Plastibell.
Okay, I've heard of those.
Yeah, so the Mogen clamp is a more traditional tool that's often used in ceremonial Jewish circumcisions.
Performed by a mole?
Yeah, performed by a mahal.
Okay.
And then the Plastibell is
Yeah.
more commonly used by pediatricians.
All right, so this is for newborns.
Yeah.
Okay.
Basically, they place a plastic ring or a bell
Okay.
over the gland.
Over the head of the penis.
Yeah.
Got
They
it.
draw the foreskin over it.
Okay.
And then they tie a suture around the foreskin, compressing it.
So they're basically cutting off the blood supply
Yeah.
to the foreskin.
Yeah. And eventually the excess skin
Yeah.
dries and falls off
Like-
along with the plastic ring.
Interesting.
Yeah. And this typically happens within a week or two.
A week or two, okay.
Yeah. And the book points out that this is a safe and widely used method.
So it's pretty common procedure.
Yeah. Very common.
Yeah. And then there's the Shang ring circumcision.
The Shang ring.
Yeah.
Okay. Haven't heard of that one.
So this is presented as a more modern technique.
Okay. So this is newer.
Yeah, particularly for adults.
So not for newborns.
Yeah.
Okay.
And it's basically a sterile device
Okay.
that's made of two concentric plastic rings.
Concentric.
Yeah.
Meaning one inside the other.
Yeah. Yeah. And the inner ring has a silicone band.
Silicone. Okay.
Yeah.
To make it comfortable, I guess.
Yeah. And the outer ring is hinged.
Hinged so it can open and close.
Yeah.
Got it.
And they lock together, compressing the foreskin.
Okay, so it's like a clamp,
Yeah. Yeah.
but it's a ring shape.
Yeah.
Got it.
And what's significant about this is that it seals the skin edges,
Okay.
which often eliminates the need for sutures.
No stitches.
Yeah.
That's good.
Yeah.
Less invasive.
And it also has a locking mechanism.
Okay, a safety feature.
Yeah, to prevent accidental or premature removal.
Okay. Yeah.
It won't come off until it's supposed to.
Right, right.
Yeah.
And it comes in various sizes.
Oh, so they can customize it
Yeah.
to the individual.
Yeah.
That's good.
So, what are the key advantages of this Shang ring method?
Yeah. What makes it better?
So, the chapter highlights that it's a very quick procedure,
Okay.
often taking less than 15 minutes to apply.
15 minutes. That's pretty fast.
Yeah. And it typically only requires local anesthesia initially.
Oh, so you don't have to go under general anesthesia.
Right.
That's good.
And patients generally report minimal pain.
Okay, that's a big plus.
Yeah.
Less pain, that's always a good thing.
Yeah.
So less pain, quicker procedure.
Yeah.
Sounds pretty good.
Yeah.
So regardless of the method,
Yeah.
post-operative care is important.
Yeah, absolutely.
What does the book say about that?
So the chapter gives pretty clear post-operative advice.
Okay.
It recommends resuming normal activities,
Okay.
but avoiding anything strenuous.
All right, so take it easy.
Yeah, take it easy.
Don't overdo it.
Yeah, anything that causes pain or discomfort.
Yeah. Listen to your body.
Yeah.
Rest up.
Showering is usually fine after 2 days.
Okay, so you can't shower right away.
Right.
2 days.
Yeah.
Got it.
But you have to reapply any dressings after.
Dressings? Okay.
Yeah.
Makes sense.
And swimming and trips to the beach.
Oh, fun stuff.
Yeah.
You gotta wait for that.
Yeah, you gotta wait for that.
How long?
For about 2 weeks.
2 weeks. Okay.
Yeah.
Not too bad. And then there's a 4-week period.
4 weeks a month.
Yeah. Where sexual activity and masturbation are not advised.
Okay, so no sex for a month
Yeah. Got it.
to allow for proper healing.
Makes sense. You don't want to irritate the area.
Right.
Right. Right. So that's something to keep in mind.
Yeah.
4 weeks.
Yeah. And the chapter also notes that some minor bleeding
Okay.
can be expected.
A little bit of blood.
Yeah, like occasional drops of blood.
Yeah, that's
During
normal.
the first couple of weeks.
Okay.
Yeah.
So don't be alarmed if you see a little bit of blood.
Right.
It's part of the healing process.
Yeah. And some men might experience discomfort with nighttime erections.
Oh, yeah, that could be a problem.
Yeah.
Especially in the first week.
Yeah, in the first week. But this typically resolves.
Okay, so it's temporary.
Yeah. And then if sutures were used.
Right, the stitches.
Yeah.
Do those have to come out?
The book mentions that they're usually absorbable.
Okay, so they dissolve on their own.
Yeah, and don't require removal.
That's convenient.
Yeah, unless a non-absorbable type was used.
Okay, so there's different types of stitches.
Yeah.
Got it.
So to summarize.
Yeah, let's recap.
Yeah, what are the main benefits of circumcision?
According to the book.
Yeah.
All right.
So the chapter reiterates that the evidence supports circumcision in reducing the risk of sexually transmitted diseases.
STDs.
Yeah, urinary tract infections.
UTIs.
Yeah, UTIs.
Right.
Penile cancer.
Penile cancer.
Yeah.
Those are some serious conditions.
Yeah.
So that's good that it can help prevent those.
Yeah, and it also emphasizes that it's generally a safe procedure.
Okay. It's reassuring.
Yeah.
Safe and effective.
With minimal risks.
Minimal risks.
And side effects.
Okay.
While acknowledging that there's the potential for a mild decrease in sensation.
Right, we talked about that.
Yeah.
Some people might experience that.
For some individuals.
Okay.
So yeah, that was chapter 92.
Wow, that was a lot of information.
Yeah, we covered a lot of ground there.
Yeah, we did.
And I gotta say, the 21st century man does a really good job
Yeah, I agree.
of presenting this topic.
It's a sensitive topic.
Yeah.
And they handle it really well.
Yeah, they lay out the information.
The facts.
Yeah.
Without taking sides.
Yeah.
Which is important.
Yeah, in a
Yeah.
clear, factual, and accessible way.
Absolutely. It's easy to understand.
Yeah.
Even for someone who doesn't know a lot about the topic.
Yeah, definitely.
Yeah.
So for anyone listening who wants to learn more about this and other aspects of men's health.
Yeah, there's a lot more in the book.
Yeah.
Yeah.
We definitely recommend picking up a copy of The 21st Century Man.
It's a great resource.
Yeah, it's packed with information.
Yeah.
And presented in a very clear
An approachable style.
and approachable way.
Yeah. It's not intimidating.
Yeah.
It's easy to read.
Yeah, for sure.
Good stuff.
So that brings us to the end of our deep dive into chapter 92.
All about circumcision.
Yeah, circumcision.
We covered a lot.
Yeah, we covered the history, the prevalence.
The benefits, the risks,
Yeah, benefits, the risks, the different techniques.
all the different ways to do it.
Yeah, all drawn directly from the book.
Yeah, straight from the source.
So hopefully this has provided you with a good understanding.
Yeah, a better understanding of this topic.
Yeah.
It's fascinating stuff.
Yeah, and it's interesting how a procedure with such ancient roots.
Yeah, thousands of years old,
Yeah.
still relevant today.
Is still relevant in modern health.
Absolutely.
Yeah.
It's
And
amazing how things come full circle.
Yeah. So please join us next time
Yes, join us
on the 21st Century Man podcast
for another deep dive.
as we delve into chapter 93,
Chapter 93.
sexually transmitted infections.
Ooh, that's going to be a good one.
Yeah, that'll be an interesting one.
Can't wait.
Looking forward to exploring that with you.
Yeah, see you then.
All right.
Take control of your health anytime, anywhere. Visit globalmenswellness.com and start your free trial today. Get expert-level answers in seconds, not weeks, without the cost, the wait, or the awkward conversations. Real support on your terms. Visit globalmenswellness.com now.